Did you know that nearly 1 in 3 adults will experience some form of neck or back pain this year? That's a staggering number that hints at how common musculoskeletal issues really are. Today we're diving into the most frequent conditions that keep people glued to their couches.
I love that stat, Alex, because it shows why our listeners should tune in. We're going to unpack everything from cervical spondylosis to gout, breaking down the science in plain language. By the end, you'll know how to spot the signs and what steps can help.
Exactly, Sarah. We'll explore the anatomy, the typical symptoms, and the latest treatment options, all while keeping the conversation lively. Expect a mix of facts, real-world examples, and a few surprising twists.
And here's the roadmap. We'll start at the top of the spine, work our way down through the hips and shoulders, and finish with the joints that often get overlooked. We'll sprinkle in personal stories and listener questions along the way.
I remember my own bout with a stubborn neck ache that turned out to be cervical spondylosis. Talk about a wake-up call. It taught me that early detection can change the whole recovery trajectory. So stay with us as we untangle these conditions.
All right, let's jump in. First up, the neck, cervical spondylosis. What most people don't realize is that it's essentially osteoarthritis of the neck, and it can be more than just a sore.
Cervical spondylosis occurs when the vertebrae develop bony spurs and the intervertebral discs lose hydration. These changes can compress nerves, leading to pain that radiates down the arms or even cause dizziness. The condition often progresses silently until the symptoms become noticeable.
That sounds painful, Alex. But here's what's really interesting. Many people experience neck stiffness in the morning and chalk it up to poor sleep, yet it could be an early sign of spondylosis. Physical therapy focusing on neck extension and posture correction can halt progression.
Exactly. And in severe cases where the spinal cord is compressed, surgical decompression may be necessary. However, most patients respond well to a regimen of NSAIDs, targeted exercises, and ergonomic adjustments. What do you think, Sarah? Should we encourage listeners to get a cervical spine X-ray if they notice persistent symptoms?
I would say a doctor's evaluation is key, Alex, especially if numbness or weakness appears in the hands. And that's just the beginning of our spine journey. Next, we'll explore herniated discs, which often masquerade as simple back pain.
A herniated disc or slipped disc happens when the gel-like nucleus pulposus pushes through the tougher annulus fibrosus. This protrusion can irritate adjacent spinal nerves, producing sciatica in the lower back or radicular pain in the neck. Most herniations improve within 6 weeks with conservative care.
But here's where it gets fascinating. Even a small tear can trigger intense pain because the disc material is inflammatory. Staying active, light walking, gentle stretching actually speeds up the healing process, contrary to the urge to stay in bed. Have you ever tried a McKenzie extension program, Alex?
I have, and it helped my own lower back flare. For those with severe nerve compression, microdiscectomy offers relief with a relatively short recovery. Yet studies show that most patients avoid surgery by combining core strengthening with proper body mechanics. What's your take on the role of imaging, Sarah?
Imaging is a double-edged sword. While MRI confirms the exact disc level, over-reliance can lead to unnecessary fear. The key is matching clinical symptoms with imaging findings. And now let's pivot to a condition that blends genetics and inflammation, ankylosing spondylitis.
Ankylosing spondylitis, AS, is a chronic inflammatory disease that primarily attacks the sacroiliac joints and spine. It often starts in early adulthood with morning stiffness that eases after movement. A strong genetic link to HLA-B27 exists, though the exact cause remains unknown.
What most people don't realize is that AS can also affect the eyes, causing uveitis, and the chest, limiting deep breathing. Early diagnosis is crucial because biologic therapies targeting TNF-alpha can dramatically slow disease progression. Alex, have you ever seen the classic bamboo spine on an X-ray?
Yes, the fusion of vertebrae gives that classic bamboo look, signaling advanced disease. Physical therapy focusing on posture, breathing exercises, and regular aerobic activity helps maintain flexibility. For those hesitant about medication, lifestyle modifications can still provide meaningful relief.
And that's just the tip of the iceberg, Alex. As can impact quality of life profoundly, especially when spinal fusion limits mobility. We'll now shift to a chest-related condition that many mistake for heart trouble, costochondritis.
Costochondritis is inflammation of the cartilage that connects the ribs to the sternum, often causing sharp chest pain that worsens with deep breaths or certain arm movements. It's usually self-limiting, resolving within weeks, but can linger for months in some cases.
But here's what's really interesting. Because the pain mimics cardiac angina, many patients undergo extensive cardiac workups before the correct diagnosis is made. Simple measures like applying heat, NSAIDs, and avoiding heavy lifting can speed recovery. Alex, have you ever experienced this?
I haven't personally, but a colleague described the relief after learning proper breathing techniques. And now, moving from the chest to the joints, let's discuss bursitis, which often plagues athletes and laborers alike.
Bursitis is the inflammation of a bursa, a small fluid-filled sac that reduces friction around joints. Common sites include the shoulder, elbow, knee, and hip, and repeated stress often triggers it. Alex, did you know that trochanteric bursa is one of the most frequently affected in runners?
Exactly. And the hallmark symptoms are localized pain, swelling, and limited range of motion. While rest and NSAIDs are first line, corticosteroid injections can provide rapid relief for stubborn cases. Did you know that certain infections can also cause septic bursitis, requiring antibiotics?
I did, and that's why it's vital to differentiate sterile from infectious bursitis. Ultrasound guidance improves injection accuracy and reduces complications. And here's where it gets fascinating, Alex. If untreated, chronic bursitis can lead to calcific deposits that mimic bone spurs, complicating diagnosis.
That progression underscores the importance of early intervention. Physical therapy, focusing on stretching and strengthening the surrounding musculature, often prevents recurrence. Next up, we have a quirky condition that makes the hip snap, snapping hip syndrome.
Snapping hip syndrome. Syndrome presents as an audible snap when the hip moves, often seen in dancers and athletes. The iliotibial band, or iliopsoas tendon, usually slides over a bony prominence, creating that characteristic sound. Alex, have you observed this pattern in any of the patients you treat?
Most of the time, the snapping is painless, but when inflammation sets in, it can become quite uncomfortable. Conservative treatment includes targeted stretching, foam rolling, and activity modification. In rare cases where pain persists, arthroscopic release may be considered.
And that's a perfect segue to a condition that truly freezes movement: frozen shoulder or adhesive capsulitis. Ready, Alex?
Frozen shoulder progresses through 3 phases: freezing, frozen, and thawing. The exact cause is unknown, but it often follows immobilization after injury or surgery. Sarah, the early aggressive physical therapy can really shorten the freezing phase and restore motion faster.
What most people don't realize is that early aggressive physical therapy can shorten the freezing phase dramatically. Gentle joint mobilizations combined with anti-inflammatory meds can restore range of motion faster than waiting for the thaw. Alex, have you ever seen a patient regain full rotation in just a few months?
I have, and it reinforces the mantra, move it or lose it. Now let's shift to a joint we use every day, the jaw. Temporomandibular joint dysfunction is next on our list.
TMJ dysfunction involves the muscles and joints that control chewing, leading to jaw pain, clicking, and ear discomfort. Stress-induced clenching, malocclusion, and arthritis are common culprits. Alex, what's your favorite self-care tip for patients struggling with jaw tension?
A simple night guard can alleviate clenching, while physiotherapy targeting the masticatory muscles improves alignment. In severe cases, orthodontic correction or arthroscopic surgery may be indicated. Sarah, what's your go-to tip for patients with jaw clenching?
I always suggest warm compresses combined with gentle jaw exercises, like opening the mouth slowly to a comfortable limit and holding for a few seconds. Consistency is key, Alex, and that brings us to a metabolic condition that attacks joints: gout.
Gout results from uric acid crystal deposition, most famously in the big toe, causing sudden, excruciating pain. Diets high in purines, red meat, organ meats, and certain seafood raise uric acid levels, as do alcohol and some diuretics.
What most people don't realize is that gout can also affect the knees, wrists, and even the ears, forming tophi. Acute attacks are treated with colchicine or NSAIDs, while long-term urate-lowering therapy prevents recurrences. Alex, have you tried cutting down on red meat?
I have, and reducing sugary drinks made a noticeable difference. Finally, we arrive at the sacroiliac joint, often the hidden source of lower back pain. Let's explore sacroiliac joint dysfunction.
Sacroiliac, stadium SI joint dysfunction occurs when the joint connecting the sacrum to the ilium becomes inflamed or misaligned, leading to pain in the lower back, buttocks, or groin. Pregnancy, heavy lifting, and uneven gait are common triggers.
Physical therapy. Focusing on pelvic stabilization, core strengthening, and joint mobilization can restore function. In refractory cases, corticosteroid injections or radiofrequency ablation provide relief. And that's a wrap on our deep dive into musculoskeletal conditions.
Before we close, let's highlight 3 key takeaways: early recognition, active rehabilitation, and when to seek professional care. Remember, most of these conditions improve with proper movement and lifestyle tweaks.
And don't forget, staying informed empowers you to make smarter health decisions. If you found this episode helpful, share it with a friend who might be dealing with any of these aches.
Thanks for listening to Musculoskeletal Minute. Next week, we'll tackle common sports injuries and how to prevent them. Stay active, stay curious, and we'll see you soon.
Remember, knowledge is the first step toward relief, and a little movement goes a long way. Keep an eye on your body and don't ignore persistent pain.
That's right, Alex. And if you have questions or topics you'd like us to cover, drop us a note on our website. We love hearing from you.
Until next time, stay healthy and keep moving. Bye for now.
Welcome back, listeners. Imagine twisting your leg during a casual soccer game and feeling an instant snap in your knee. That sharp pain that makes you wonder if you just broke something. Today, Alex and I are unpacking that moment and a whole roster of other musculoskeletal mysteries you might have heard about but never fully understood. We'll break down the science, share real-world examples, and give you practical takeaways you can use the next time you hit the gym or the playground.
Thanks, Sarah. In this episode, we'll explore everything from meniscus tears and patellofemoral pain syndrome to less common conditions like plica syndrome and compartment syndrome. Our goal is to build from basic anatomy to nuanced treatment options, so you walk away with a clear mental map of why these injuries happen and how they're managed. Stay tuned. We'll also sprinkle in a few surprising statistics that might change how you think about joint health.
But here's what's really interesting. Many of these ailments share a common thread. They're often the result of tiny, repetitive stresses that add up over time. Think of your body like a car. If you keep ignoring that little rattling noise, it can turn into a major breakdown. We'll show you how early intervention can keep those noises from becoming costly repairs.
Exactly. And we'll also highlight where the myths end and the evidence begins. By the end of the hour, you'll know which symptoms demand immediate medical attention and which can be safely managed at home. Ready to dive in?
Absolutely. Let's kick things off with a classic sports injury, the meniscus tear. Alex, why does that little piece of cartilage get torn so often?
Great question, Sarah. The meniscus acts as a shock absorber between the femur and tibia, and a sudden twist can shear it, especially in athletes who pivot quickly. Symptoms typically include sharp knee pain, swelling, and difficulty straightening the leg. Treatment ranges from rest and NSAIDs for minor tears to arthroscopic surgery for severe damage.
What most people don't realize is that not every knee pain is a meniscus issue. Patellofemoral pain syndrome, often called runner's knee, causes a dull ache around the front of the knee without any cartilage damage. It gets worse when you climb stairs or sit with your knees bent for long periods. Rest, targeted strengthening, and physical therapy usually do the trick.
Exactly, Sarah. And here's where it gets fascinating. The plica, a fold of tissue that normally disappears before birth, can persist in some adults and become inflamed, leading to Plicker syndrome. The pain is localized to the inside front of the knee and spikes during bending or after exercise. Conservative care includes rest, NSAIDs, and corticosteroid injections, surgery as a last resort. This condition shows how embryological remnants can cause adult discomfort.
Speaking of fluid buildup, let's talk about Baker's cysts. These are swellings filled with synovial fluid that develop behind the knee, often linked to osteoarthritis or rheumatoid arthritis. Most are painless, but if a cyst ruptures, you can feel sudden calf pain that mimics a blood clot. Treatment may involve anti-inflammatory meds, aspiration, or rarely, surgical removal.
That reminds me of ganglion cysts, which are more common on the wrist but can appear near any joint, including the knee. They're benign, fluid-filled sacs that may sit unnoticed for years. If they become painful or restrict movement, a simple aspiration or surgical excision can provide relief. The key takeaway is that not every lump needs aggressive intervention.
And here's a condition many associate with older adults: bunions. A bunion forms when the big toe joint drifts outward, causing the bone to protrude and the surrounding tissue to thicken. Pressure from shoes exacerbates the inflammation, leading to pain and swelling. Early management includes wider footwear, bunion splints, and orthotics. Severe cases may require osteotomy surgery.
Right, Sarah. Joint instability is another hidden culprit behind chronic pain. When ligaments, muscles, or tendons fail to support a joint properly, you get abnormal motion that can lead to dislocation or early arthritis. The shoulder is a classic example. A loose joint can cause tingling, weakness, and occasional subluxation. Physical therapy to strengthen the rotator cuff and, if needed, surgical stabilization are common solutions.
But the real game changer is understanding dislocations. Whether it's a knee, shoulder, or even a finger, a dislocation occurs when the bones are forced out of their socket, often tearing surrounding ligaments. Immediate care involves gentle manipulation back into place followed by immobilization. In some cases, surgery is required to repair torn structures and prevent recurrent dislocation.
Exactly. And whiplash is a perfect illustration of how a seemingly minor neck movement can cause major damage. Rapid back-and-forth motion, like in a rear-end car crash, stretches or tears cervical ligaments and can even fracture vertebrae. Symptoms may include neck pain, headaches, dizziness, and arm numbness. Early treatment focuses on ice, NSAIDs, and gentle range of motion exercises, while persistent cases benefit from physiotherapy.
What most people don't realize is that whiplash isn't limited to car accidents. Sports collisions and even sudden falls can produce the same mechanism. And here's where it gets fascinating. The severity can range from a mild strain that resolves in weeks to a catastrophic spinal cord injury requiring surgery. The takeaway? Never ignore persistent neck pain after a jolt. Early evaluation can prevent chronic issues.
Moving down the spine, cervical disc herniations are another source of neck and arm pain. When the gel-like nucleus pulposus protrudes through the annulus fibrosus, it can compress nerve roots, causing radiating pain and weakness. Conservative care includes physical therapy, anti-inflammatories, and sometimes epidural steroid injections. Surgery, such as anterior cervical discectomy and fusion, is reserved for refractory cases.
Speaking of muscle issues, let's talk about cramps. Most of the time they're harmless, caused by dehydration or overexertion, but they can be startling. Stretching, massage, and proper hydration usually resolve them quickly. In rare chronic cases, a doctor might prescribe quinine or a muscle relaxant to break the cycle.
Now, a less familiar but important condition is polymyalgia rheumatica. It predominantly affects adults over 50, causing morning stiffness, shoulder and hip pain, and elevated inflammatory markers. High-dose corticosteroids are the mainstay of treatment, often tapering over a year or more. Early diagnosis is crucial to prevent complications like giant cell arteritis.
And that's just the beginning. Ligament sprains and tears are next on our list. The ACL, PCL, MCL, and ankle ligaments are the most frequently injured, especially in pivoting sports. A sprain involves microscopic tears, while a full rupture requires surgical reconstruction. Early RICE, rest, ice, compression, elevation, and a structured rehab program can restore stability and function.
Exactly, Sarah. Chronic ankle instability often follows repeated sprains, leading to a feeling of the ankle giving way. Strengthening the perineal muscles and proprioceptive training are key to preventing future injuries. In refractory cases, a ligament reconstruction may be indicated.
But here's what's really interesting. Restless leg syndrome, shishi, RLS, isn't just an annoyance, it can severely disrupt sleep. People describe an irresistible urge to move their legs, often accompanied by tingling or burning sensations, especially at night. Lifestyle changes like regular exercise and caffeine reduction help, while dopaminergic agents are used for moderate to severe cases.
And let's not forget fibromyalgia, a condition characterized by widespread musculoskeletal pain, fatigue, and cognitive fog. The exact cause remains unknown, but central sensitization of pain pathways is a leading theory. Treatment is multimodal: low-dose antidepressants, gentle aerobic exercise, and cognitive behavioral therapy. Patients often benefit from a supportive interdisciplinary approach.
Now, for the younger crowd, Sever's disease is a common cause of heel pain in growing kids. The calcaneal apophysis is still developing, and repetitive jumping can inflame it. Rest, heel cups, and NSAIDs usually resolve the pain within weeks. It's a reminder that even seemingly minor sports activities can stress immature bone structures.
Switching gears, myasthenia gravis is an autoimmune disorder where antibodies block acetylcholine receptors, leading to muscle weakness. Early signs include drooping eyelids and difficulty swallowing. Acetylcholinesterase inhibitors, immunosuppressants, and sometimes thymectomy are part of the treatment arsenal. Prompt recognition is vital because respiratory crises can be life-threatening.
And speaking of shoulders, rotator cuff disorders are a major source of shoulder pain, especially in people who do repetitive overhead work. Tears can be partial or full thickness, leading to pain and limited range of motion. Rest, physical therapy, and subacromial corticosteroid injections help most patients, but large tears often need arthroscopic repair.
Piriformis syndrome is another hidden culprit behind buttock and leg pain. The piriformis muscle can compress the sciatic nerve, causing tingling, numbness, and pain radiating down the leg. Stretching, heat therapy, and targeted physical therapy usually provide relief. In refractory cases, a botulinum toxin injection may be considered.
Here's where it gets fascinating. Compartment syndrome can develop acutely after a fracture or chronically after intense exercise. The pressure builds up within a closed muscle compartment, threatening blood flow and nerve function. Acute cases demand emergent fasciotomy, while chronic presentations often improve with activity modification and physical therapy.
Muscle strains and tears are the most common injuries across all sports. A strain ranges from microscopic fiber tears to a complete rupture, with symptoms like sudden sharp pain, swelling, and loss of strength. The RICE protocol applies, but severe tears may need surgical repair, especially in elite athletes. Proper warm-up and conditioning are the best preventive measures.
And don't forget hamstring injuries. They're notorious in sprinters. The hamstrings cross both the hip and knee, so a sudden sprint can overload them, leading to a strain or tear. Rest, progressive loading, and eccentric strengthening are key to a safe return to sport. As you get older, recovery may take longer, highlighting the importance of maintenance work.
To wrap up this whirlwind tour, let's recap the common threads. Many of these conditions stem from repetitive microtrauma, poor biomechanics, or delayed treatment. Early recognition, appropriate imaging when needed, and a balanced approach of rest, rehab, and, when necessary, surgical intervention can dramatically improve outcomes. Sarah, any final thoughts on how listeners can protect themselves?
Absolutely, Alex. Listen to your body. Pain is a warning signal, not something to push through. Incorporate regular strength and flexibility work, choose proper footwear, and don't ignore swelling or persistent discomfort. And when in doubt, seek a qualified health professional before the problem escalates. Prevention truly is the best medicine.
We've covered a lot today, from meniscus tears to compartment syndrome, and hopefully demystified many of the aches that keep you up at night. Remember, early intervention and a proactive approach to joint health can keep you moving longer.
Thanks for joining us, everyone. If you found this episode helpful, share it with a friend who might need a knee check or a reminder to stretch those hamstrings.
Don't forget to subscribe and leave a review. It helps us bring more deep dive health topics your way. And stay tuned for our next episode where we'll explore the hidden world of foot biomechanics and why those pesky plantar fasciitis cases happen.
Until then, keep moving, stay curious, and take care of those amazing bodies of yours. See you next time.
Goodbye.
Bye! Did you know that a simple run can set off a cascade of injuries you've probably never heard of? Today, we're diving into everything from AT band syndrome to brain aneurysms. And trust me, you'll want to stick around for the surprising connections.
That's right, Sarah. I'll be breaking down the anatomy, the symptoms, and the science-backed treatments, while you'll keep us grounded with real-world examples and a dash of humor.
We'll start with the infamous AT band syndrome, a runner's nightmare, and then hop over to Charlie horses, repetitive strain injuries, and a whole host of tendon troubles.
Later, we'll explore neurological issues like migraines, seizures, and even the scary world of brain tumors. By the end of the episode, you'll have a clear action plan for each condition.
So whether you're an athlete, a desk warrior, or just curious about your body, stay tuned. And remember, the first clue to preventing injury is knowing what to look for.
Let's kick off with the iliotibial band, or IT band. It's a thick band of connective tissue that runs from the pelvis down the outside of the thigh to just below the knee, anchoring on the tibia.
Exactly, Alex. When you repeatedly bend and straighten the knee, think long runs or cycling, the band can rub against the knee joint, causing inflammation and that sharp outer knee pain we call AT band syndrome.
And the treatment is surprisingly straightforward. Rest, ice, and NSAIDs to curb inflammation. But here's what's really interesting. Strengthening the hip abductors can actually prevent the syndrome from recurring.
That's a great point, Alex. And it leads us to the classic Charlie horse, a sudden quadriceps cramp caused by a blunt impact that crushes the muscle against the femur.
A Charlie horse often presents with immediate pain, swelling, and sometimes a tingling sensation. The muscle may become stiff, limiting movement.
Treatment? Price. That's rest, ice, compression, elevation, plus gentle stretching once the acute pain subsides. What most people don't realize is that dehydration can be a hidden trigger.
Moving on, let's talk about repetitive strain injury, or RSI, which plagues anyone who spends hours at a keyboard. The neck, shoulders, arms, and hands are the usual suspects.
And the symptoms can be a nightmare: tingling, throbbing, stiffness, even cramping. The good news? Adjusting ergonomics and taking micro breaks can make a world of difference.
Exactly, Sarah. Physical therapy and supportive braces also help, but the key is modifying the activity that caused the strain in the first place.
Now let's dive into the sprawling family of tendon disorders: tendinitis, tenosynovitis, and even tendon ruptures. These conditions often overlap and are usually overuse injuries.
Take Achilles tendinitis, for example. It's inflammation of the tendon that connects calf muscles to the heel bone, common in runners and jumpers. Pain, swelling, and a stiff morning feel are typical.
What's fascinating is that tenosynovitis, inflammation of the tendon sheath, can cause a crackling sensation when the tendon moves, almost like a squeaky door hinge.
Treatment across the board involves rest, ice, NSAIDs, and sometimes a brace or splint. In severe cases, corticosteroid injections or even surgery may be needed.
Speaking of surgery, a complete tendon rupture, say a biceps tendon tear, is a dramatic event. You'll hear a snapping sound, feel sudden severe pain, and lose the ability to use that limb.
In many instances, a ruptured tendon can heal with immobilization, but often surgical repair followed by physical therapy yields the best functional outcome.
And don't forget about plantar fasciitis, the painful band under the foot that flares up after a period of rest. It's a classic case of overstretching during activity.
The hallmark is heel pain that's worst with the first steps in the morning. Stretching, orthotics, and night splints are the frontline treatments.
Now let's shift gears to the elbow. Lateral epicondylitis, aka tennis elbow, and medial epicondylitis, or golfer's elbow. Both involve tendon attachment damage, but on opposite sides of the joint.
Repetitive twisting motions of the forearm are the culprits. Pain worsens with gripping or lifting, and the swelling can be palpable.
Most cases resolve with rest, ice, and anti-inflammatories. But severe cases may need physical therapy or corticosteroid injections. And here's a cliffhanger. The next segment will reveal a surprising home remedy that actually works for many people.
Before we get there, let's talk about neurological headaches. Tension-type headaches are the most common, caused by muscle tightening in the neck and scalp.
And while most headaches are benign, we have to watch out for red flags like sudden onset, worsening after 24 hours, or associated vomiting and visual changes. Those could signal something serious like a brain aneurysm.
Cluster headaches, on the other hand, are excruciating attacks around one eye, often accompanied by tearing and nasal congestion. They come in cycles, days or weeks of daily attacks followed by remission periods.
Treatment for clusters can be as simple as high-flow oxygen or as advanced as nerve stimulation. It's a reminder that not all headaches are created equal.
Migraines add another layer of complexity. They're thought to involve abnormal brain activity, neurotransmitter shifts, and vascular changes, often triggered by stress, diet, or hormonal fluctuations.
And the aura, those flashing lights or tingling sensations before the pain, can be a warning sign. Avoiding triggers and using prophylactic medication can keep them at bay.
Moving from headaches to chronic fatigue syndrome, a condition marked by overwhelming, unexplained fatigue that lasts for months, often after an infection or trauma.
Patients also report brain fog, muscle pain, and sleep disturbances. While there's no cure, graded exercise therapy and cognitive behavioral therapy can improve quality of life.
Head injuries range from minor bumps to life-threatening trauma. A concussion may cause a brief loss of consciousness, but a severe injury can lead to swelling, hemorrhage, or permanent deficits.
If you notice persistent headache, vomiting, or neurological changes after a hit, seek medical help immediately. Time is brain, literally.
Epilepsy is another neurological disorder where abnormal electrical activity triggers seizures. Triggers can include flashing lights, stress, or sleep deprivation.
Partial seizures affect one brain region, causing localized twitching or sensory changes, while generalized seizures involve the whole brain, leading to loss of consciousness.
Most patients achieve seizure control with medication, but status epilepticus, a prolonged seizure, is a medical emergency requiring immediate intervention.
Narcolepsy brings its own challenges: sudden daytime sleep attacks, cataplexy, and sleep paralysis. It's linked to a deficiency in hypocretin, a brain chemical that regulates wakefulness.
Scheduled naps and stimulant medications can help manage symptoms, but lifestyle adjustments are essential for safety, especially when driving.
Now let's talk about meningitis, inflammation of the membranes protecting the brain and spinal cord. Bacterial forms can be deadly, while viral cases are often milder.
Key symptoms include fever, stiff neck, photophobia, and a rash that doesn't blanch. Prompt antibiotic treatment for bacterial meningitis can be life-saving.
Vaccination has dramatically reduced the incidence of certain types, yet awareness remains crucial. And that's just the beginning of our deep dive into brain health.
Finally, let's address strokes and transient ischemic attacks, or TIAs. A TIA is a brief loss of blood flow that resolves within 24 hours, serving as a warning sign for a potential full-blown stroke.
Risk factors include hypertension, high cholesterol, smoking, and diabetes. Immediate medical evaluation can prevent permanent damage.
In an ischemic stroke, a clot blocks an artery, while a hemorrhagic stroke involves bleeding from a ruptured vessel. Both require rapid intervention, clot-busting drugs, or surgical evacuation.
And there you have it, a whirlwind tour from the outer knee to the inner brain. We've covered symptoms, treatments, and preventive tips for a whole spectrum of injuries and disorders.
If today's episode sparked a question or you recognized a symptom, consider reaching out to a healthcare professional for personalized advice.
And don't forget to subscribe, leave a review, and share this podcast with friends who might benefit from a deeper understanding of their bodies.
Next week, we'll explore nutrition's role in injury prevention, from anti-inflammatory foods to optimal hydration strategies.
You won't want to miss it. It's going to be both tasty and science-packed. Until then, stay active, stay aware, and stay healthy.
Thanks for listening to the Body Talk podcast. I'm Alex.
And I'm Sarah. See you next time.